Hey there, leg twitchy people. My name is Jason. I'm a registered polysomnographic technologist, and I will not stop doing these videos until I hear a 5-year-old say,
"When I grow up, I want to be a sleep disorder technologist, just like Jason."
All right, the purpose of this video is to discuss periodic limb movement disorders, leg movements, leg jerks, leg twitches, whatever you got. So the question I typically get usually revolves around, am I having leg movements? Is this a problem for me? What can I do about it? We will get to that in just 1 second. Let's go ahead and show you what we're looking at here. So this is a sleep study. We have all of our parameters. We have the eyes, or these top two. We have the chin. We have frontal. This is your EEG, or brain activity. We have this ugly looking thing is snore. I'm going to decrease that because good Lord. Then we have the right leg and the left leg. I'm going to highlight this in blue so you can really see it. These are the leg movements that we're talking about. So the 2, 3, 2, 3, this is the stage of sleep that they're in. Down here, flow is the breathing. And then we have the 2 belts. These are effort belts. Are they even trying to breathe and how much? That kind of thing. So we're really focusing on the flow because they're asleep during all of this, the leg movements, and then some of the thoracic and abdominal effort that we're seeing. Okay, first thing I want you to make note of is there are leg movements very, very frequently. Okay, so to have a true leg movement, it has to not be associated with a sleep disordered breathing event. And it can be associated with an arousal, but there cannot be a sleep disordered breathing event. So some of these on this page happen to me, look like very, very, very subtle sleep disordered breathing events. And by that, I mean this one, it's kind of hidden behind my head. This guy right here, you can see how leg movement, it really drops off here. This guy's going to be flat. There is an arousal and we have a leg movement right there. That's about the only one on this page. This one right here, breathing is totally just straight. We don't have any arousal up here and there is a leg movement. Same with this one, this one. So there is leg movements occurring and there is no sleep disordered breathing that's like really, really, really clear. I would say though, if you look at the SpO2 data, there's some up and down and up and down. So maybe there's a little bit of instability in the breathing. And I would say that that would be kind of true because we do have some of these little spikes every now and then. And the breathing is a little up and down, which explains the little bit of up and down in the SpO2 sensor down here. But if someone is having this level of leg movements without any really clear sleep disordered breathing, like we see right here, what I would say to do is try over-the-counter medications such as iron supplements, magnesium supplements, manganese supplements, and I would obviously listen to your doctor, but typically they want to give you gabapentin, and sometimes it can just be handled with some over-the-counter medications such as that. Okay, so what if it is beyond this? By the way, this is a sleep study with no CPAP, no bilevel. So what if you have some other things, and I think it's around the 1 a.m. mark. Okay, so now we have same thing. You'll get all these leg movements. These leg movements, if we compare it to before, look at these huge troughs right here popping up quickly. This is respiratory effort related arousals for sure. We have the leg movement. We have a clear awakening right here. This is on a 10-minute segment. So let me do this for you so we can see it just a little bit easier. Put it on a 5-minute window. So you can see these are really dropping quite a bit. You can see very clear flattening on the tops of these waves, gasping for air, and a leg movement. So this leg movement's not going to count because it is associated with a sleep disordered breathing event. Now, if you do notice, this person before, they were on their side. So it wasn't quite as much. Now that they're on their back though, we see a lot more of these sleep disordered breathing events, and they are like back to back to back. So go ahead and fast forward just a little bit. You can see all of these occurring back to back to back sleep disordered breathing events. Same SpO2 desaturations occurring at a very low level, but tons of arousals associated with it. What's really confusing about this one, I believe, if I go forward just a little bit, okay, now they're on their right side, so it's not positional. They're doing the same thing. Very clear flattening throughout here, very clear respiratory gasps, really clear decrease there, respiratory gasp, arousal, it's a rira, 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 back to back to back. So in this case, if someone is doing this all night long, they're doing it on their right side, they're doing it on their back, what you typically want to do is either put them on CPAP and titrate them. These will often go away with increased CPAP pressures. So in this case, if someone is like right here and they're on CPAP, and you're still, this is as a tech, like you would see these leg movements and you're like, man, I'm not really seeing any clear sleep disorder breathing events. Like none of these, you can see a clear sleep disorder breathing event at all in this window. If you increase them like 1 or 2 centimeters of water, these typically go away. At that point, then you can safely say, okay, these were caused by respiratory events. So just increasing the pressure adds usually more oxygen, keeps your airway open more, the leg movements stop. If they don't stop, that's when you know you're dealing with a true periodic limb movement disorder. You can still try those over-the-counter supplements, but sometimes you do need to go to something a little more hardcore like gabapentin. So that's like a muscle relaxer, basically knocks your happy ass out. Your legs stop doing the Jimmy legs at night. Typically, this is something that really just annoys the bed partner, but you'll also wear out your sheets a lot faster and not in the good way. Now, you probably use CPAP if you're watching this channel, and if you're not wearing out your sheets, you're probably wearing out your mask. The next mask you should get from the sponsor of this video, CPAPsupplies.com, is a Fisher & Paykel Nova Micro Nasal Pillow Mask. I have personally been loving me some of this mask lately. So before we had the Brevita, you would get these nipples inverting, suffering from inverted nipple syndrome, the ins, and you don't want that. The Micro Nova, you don't get that. It has nice firm nipples. They stay out. They don't sag back, causing a massive leak. Micro Nova is super slick. It's pretty quiet too. Not as quiet as the Brevita, but very, very quiet. So if you want to get this guy, you got to put it in your cart. You look at the $109, and I want you to openly laugh at it. We're going to put in discount code LANKYSPRING, and what you're going to notice is you save yourself a ton of cash. In this case, $27.25. Now you're just paying a total of $81.75. And that is all thanks to ya boy, the Lanky Lefty 27. If you would like me to take a look at your sleep data, check out my website, axgsleepdiagnostics.com. I'm actually not done with this sleep study yet. There's another twist to this, so stay tuned on that. But before I get to that, we're going to take one quick look, because a lot of people ask me, Jason, what does Delta sleep look like? Why is it called Delta sleep? This is N3 sleep. They call it Delta sleep. For whatever reason, I keep telling people this is such a misconception. Delta sleep, you typically don't have sleep disordered breathing events in. It's really weird. I don't know why. Typically it happens during the first third of the night. In this person's case, it happens much, much later. Let's take a closer look. Why do they call it Delta sleep? Why do they call it slow wave sleep? Well, it's because you have these massive waves like this that are super slow going across. Look at those things, how slow they are. And no sleep disordered breathing, no leg movements. Pretty interesting stuff. So if we contrast that with stage 2, you can see like there's not as many of these slow waves in it. It's all this low amplitude, mixed voltage stuff. I could look at this stuff all day. What does REM look like? Rapid eye movement. Kind of harder to see close up, so I might actually pull back just a little bit. But you can see these asynchronous eye movements. The chin tone is really down, and mixed frequency, low voltage. Cool stuff. Anyway, that's all I've got for you. Hopefully you enjoyed this. If you do like this kind of content, do me a favor, subscribe to the channel, give the video a thumbs up, and comment if you have leg movements, and if you're able to get rid of them, what did you do to get rid of them? And just to repeat it one more time, if you do feel like you have leg movements and you're on CPAP, first thing to do, just increase the pressure ever so slightly. You may have to swap to bilevel to get a little slightly higher ventilation and slightly higher oxygenation and around the top of the curves of your breathing. The other thing you can do is, if that is not the problem, is you can try over-the-counter supplementation. Obviously, ask your doctor about it before you do any of this stuff, but magnesium, manganese, and iron supplements are typically the go-tos. All right, that's all I've got for you. Remember, like, subscribe, thumbs up, share the video. I appreciate you watching. Have a good night. Bye. Clean your stinky mask with some Mask Bright, available at Amazon. And time for an extra thick Thanks, buddy, to my top-level supporters, Doug Toombs, Jason Georgiades, Patricia Espelong, Stuart Hetherington, Alan Liu, Edward Steiner, and I'd like to say thank you also to these people, as well as those other people.
Up the ante, you get a shout-out. Thanks for watching. Bye-bye. Barely even on screen, but still appreciate the support.